Hello and welcome to Below the Hospital, an AME podcast on sterile processing and the issues that sterile processing technicians face today. I'm your host, Garland-Rhea Grisby Sr., sterile processing manager at Sutter Health, CPMC, and I'm also a long-standing AME member. In this podcast, I interview folks from around our industry about sterile processing and ask them what some might consider hard questions, but I always say informative questions about our profession. Today, I have the pleasure of speaking with Andy Sundet. Andy is a sales and marketing manager for inspection and airway at Clarus Medical in Minnesota. He just presented at AME Exchange on Borescope inspection programs and how they can further patient safety. Now, we understand that everybody couldn't make it out to New Orleans this year to hear that presentation, among others. So we thought it best that we should have him on the show to talk Borescopes. Andy, welcome to the show.
Thanks so much, Garland. Appreciate it. And thanks for the opportunity to connect with you all.
Thank you. So let's get some groundwork by discussing the main challenge at hand. Now, me personally, I have personal experience with borescopes for many, many years now. But Andy, could you tell our audience how borescopes present a challenge to sterile processing and scope processing professionals and their goal of ensuring patient safety?
Yeah. I mean, I think for me, the quick obvious would be, we've been inspecting the outside of devices for quite some time. Now that there's a tool, and relatively recent, within the last 15 years or so, a tool to look on the inside, it's a pretty logical, in our mind, next step. The tool's there. You'll also see this very present in other industries, looking in aircraft engines, vehicles, even pipes in your house or in the sewers. So I think that the idea of the borescope is very logical next step in progression as we improve patient safety and looking inside these complex medical devices that we're reprocessing. I would say what industry has done with borescopes has been really, really interesting. I mean, I think it's actually been led by a lot of end users, and we're finding things like Corey Ofsted's Lumen 2.0 study recently done, where we're finding things, and I think we're finding things on magnitudes that we should be watching for and looking for opportunities for improvement in. So I think that is the groundwork, if I would maybe start there, and why we're here with borescopes and where we're at.
Thank you for that. And yes, I remember the times where we couldn't see anything. It was just the external inspection and hope for the best, right? We always wondered as technicians, what is in there? And did I actually clean it right? And now we actually get to see. And some folks are afraid to see, but it's actually beneficial, not just for ourselves, but ultimately for our patients, just to be able to see. So now, with a borescope program, what's the utility of establishing an inspection program? And you can feel free to discuss the impact on patient safety and SPD operations.
So I think you picked a really good word here, inspection program. I mean, now that the tools are developed, the borescope being the tool, a program and a robust program, and developing that program is really what we're finding is a vital step. So, like I said, we see these used in other industries. They've developed over time as well. I don't think we're going to be in any kind of different progression as we all go through this. Mm-hmm. So one thing that I would say is when we see an effective program, they're really using this as a positive opportunity. Hey, now that we can look inside, let's start addressing some of these things that we're seeing, and not be worried. Some of these things are going to be concerning, but they should be looked at as opportunities. Let me throw in two other quick things while it's on my mind. Would be, I think that the things that we're going to notice would first be, hey, how are all these steps that we're doing in reprocessing working? Using a borescope to look inside at different steps in the process, it is a helpful visual tool to kind of get an assessment of how that step is working. So that's on the reprocessing effectiveness. The second thing would be on device condition. So we are noticing, and these devices that are being reprocessed on a regular basis, they might be in circulation for a long time in the department, getting a lot of heavy use. Using a borescope to see the condition of that device is also a very helpful tool.
Absolutely. Absolutely. So, what are the most important components of this kind of program?
So I'll maybe focus, like you said, the program. So, aside from borescopes and having the right borescope for what your inspection uh, workstation looks like, or the types of lumens that you're looking at, that's one piece. So like real touching base real quick on that would be making sure that you have the right borescope for the workstation that you have. It fits in the workstation, you have ample space. Make sure that you have the correct length and diameter borescope for the lumens that you're inspecting. Those would be on kind of, let's call it the hardware side of things on the borescope program. On the program or the process, I think a couple things that really come to mind. First of all, needs to be a consistent, repeatable process with efficient steps on the borescope. We find that training team members to operate the borescope is something no different than you guys are used to on a lot of other equipment that's operated, but it just takes time uh, and a process to follow. We find actually that using the borescope with the visuals that you're seeing inside actually enhances some of the other training because it's a nice visual. It's not reading through a user manual, but it's actually kind of going along on a borescope inspection with some other team members and saying, hey, look what we're seeing over here. So the visual is helpful. It's kind of a fun participation piece. Third piece being documentation. You are going to come across things that you want to take pictures of or videos of. And I think that those are helpful visuals. How you organize and document those and are able to pull those up for later use is really important. So I would say that would be a third but very important piece of a component of a highly effective program. I think the last one that I would leave the group with would be using these tools and having a process to go back to these pictures and visuals, circulate them with the key stakeholders in the group. So that might be, technicians, managers. It might be infection prevention. It might even be, the physicians or others utilizing the equipment in the procedure to show them what some of these visuals on the borescope are showing, and collectively getting everyone together to kind of tackle what we're seeing and fix what the issue that we might be seeing inside that lumen.
That is awesome. Thank you for all of those points that you touched on, especially the one about the reports. I was actually going to ask you. I was going to ask you a question about those reports later on, but you answered them, right? Just the advice for sterile processing folks who work with in-house stakeholders, right? It's always important to involve the infection prevention folks, the quality folks, the risk management folks, and even the end users so that they can understand what this program involves and the implementation of it. So thank you for answering that.
We could have spent a lot more time probably there, but maybe for a later date.
Yes, I know, because I've been there and those conversations are lengthy. And it's not, it's a good thing though, because you have everyone involved so that once it's laid out, the program is created, everybody was involved, and everybody knows the steps that are needed to make the program successful. So that's awesome. Now, what would you say are the most common questions or issues that you hear or your group hear from process and staff about borescope use and inspection?
Yeah, there's definitely a short list of ones that come up frequently. And I think we can talk through those. The more we talk through these, we find the more groups get comfortable with how to deal with these challenges, because we all have challenges in our roles. I would also say, before I get into that list, connecting with other groups that have developed the programs and have gotten past these challenging spots are great resources to lean on. So that's why I love kind of your guys' approach on the community and working together. So the likely list here that people are going to come up with would be, what devices should I inspect?
Yeah.
How often should I inspect those devices? So is this an every device every time? Is this some kind of set cadence
Yeah.
to audit? no necessarily wrong answer, but I think that there's some very good discussion that could come out of those questions. Uh, where should I look inside the device? So where are the problematic areas within certain devices? They all kind of have their areas of potential issues. Fourth one would be, I'm seeing something, and this is a hot one, Garland. I'm seeing something. What is it? And so
Yes.
yeah, what I think with the industry is more or less working towards trying to come up with some consistency in the naming. What we like to see and what we train on would be debris. It's going to be one of 4-letter D words. Debris, so something in the lumen that doesn't belong. Damage, that could be ranging from minor damage to major failure damage. Third D would be discoloration. That could be some kind of staining, which could be some type of debris, but it appears to take on some kind of color to it. So that's the third D, and then the fourth D being droplets. And this is more concerning just on a more of a terminal stage where we shouldn't see moisture droplets inside the lumen, and we're noticing them. So debris, damage, discoloration, and droplets are what we're looking for. Last common question, and I know I took a long one on that last one, but the last one I would see is, I've seen something, what next? And I think the logical step that we talk people through is just in your process having an escalation. Hey, if I'm on the front line and I see something, do I escalate it first to a manager, then to a key stakeholder or a partner on the vendor side, or your Borescope partner? All those things are good answers, and I think you get some good results on that. But that's certainly is a common question. I see something, now what?
Yes. And I remember when we first started using borescopes, even now though, staff, they say, yeah, we do see something, but what exactly am I looking at? Right?
Yeah.
Is that how this device is supposed to look? Right? Do we know what the device looks like when it's freshly manufactured compared to being used a little bit to being overused? And that's why I appreciate, like you mentioned, the 4Ds: debris, damage, discoloration, and droplets, right? And all too often, in referencing like scope repairs, sometimes you may see little marks on the inside of some scope repairs, right? And that's the repair vendor marking certain things, and it may look discolored to us, but it's a mark that they understand that we don't, right?
Yeah.
And so we may say, okay, there's something wrong. Is this blood, or what is it? And we may send it out for repair, but there's absolutely nothing wrong with it. So it's good that the device manufacturers are trying to come up with a standard that we can see and understand. No, this is fine, or this is acceptable, or this is not acceptable. So yes, thank you for that.
Mm-hmm.
So now we've seen something. What do we do, right? What are the next steps? We've taken pictures, we've taken videos. Are there any tips or best practices for using or storing these inspection reports?
Yeah. Um, these have been major developments in my mind over the past 12 months ish. So yeah, you're going to be collecting a lot of data. You're bringing up a great hot button here as to what to do and how to keep that organized. So a couple things as you're developing the program, make sure you're prepared to kind of handle this type of data, the pictures, the videos, and specifically what devices they're coming out of. A picture, once you take it, if you're not documenting where that picture was taken or what you were looking at, sometimes it's very tough to remember even what lumen that was in or even what device that was in. So that's kind of why we're bringing this one up, I would say. I would lean on there is software out there that helps you do this. It could be as basic as just developing a naming convention to the pictures and videos and storing them in a way that you already have access to on a tracking software, or even just within a program that your hospital makes accessible from like a folder storage standpoint. Could be we see things on a spreadsheet, but there's also other softwares too that can help you store this type of data. So I would kind of first establish what you want to do with those pictures and videos, outline how you might share those with the key stakeholders, whether it's just internal hospital team members or if it's outside or a combination of those. and then work with either your Borescope supplier or other vendor partners to kind of develop that a little bit further if you're needing some assistance.
Nice. Now, forgive me for this shameless Amy plug, but are there any standards or resources that you direct people to when dealing with borescopes?
Oh, yeah. So I would say it's been an exciting journey because these things are changing. They're changing quickly with the tool becoming more accessible to end users and what things are coming out of Borescope findings. We lean on and reference different categories. So on the standard side, we see AMI ST7991. We see AORN has a updated guideline. And then we also are seeing some IFUs. So if you are reprocessing shavers, Striker and Arthrex, those are two IFUs that I would say do reference lighted visual inspection inside the lumen, which in our mind signifies the use of a borescope. So those are the categories that we're seeing some of these. And I think it is really neat that the guidelines are adopting these with hospitals as we're on this journey, trying to improve based off of what we're seeing inside the lumens.
Yes, thank you. And it's hard to implement, a program when they're not out there in an IFU, in a manufacturer's IFU, or if they're not out there in a guidance document such as the ones that you mentioned. It's easy when you have those and you say, hey, look, this is what we should be doing. This is what the manufacturer's IFU says that we need to do. So we need to cover the cost and we need to, purchase these things. Why? For patient safety, so that we can inspect inside of what we can't see with the naked eye. So yes, borescopes. Thank you for all of that information.
Mm-hmm.
So that was my last question for you, Andy. Thank you for taking the time to sit and chat with us on this episode of Below the Hospital. So folks, as usual, I hope this episode has been useful. We'll be back in 2 weeks with another episode. If you want to support the podcast, you can find us at Below the Hospital on Spotify, Apple Podcasts, YouTube, and Amy Array. Until then, see you when I see you.